what to do if your knee joint replacement continues to hurt you. Initially, it's going to pain and you need to push through that initial rehab. Don't be afraid of pushing that knee joint, but sometimes even after your best efforts, that knee joint just still pains. You might be wondering why a knee joint pains. Unfortunately, low levels of infection are one of the common reasons for having a chronically painful joint. Then comes instability, or a knee joint that's too tight. That means the knee joint has too much play in it, or it just doesn't have enough play in it that causes a lot of pain. And then you have scar tissue, and then we consider malalignment or malrotation. That means malalignment, when you stand up, that knee just doesn't look right, or malrotation is sometimes more difficult, where the parts might not be put in quite the right angle. So it does require an expert to review and try and figure out what's going on. Some of the patients I see are patients that seek a second opinion because they've done their rehabilitation and still have pain in their joints. Usually that's going to be after a year or maybe a year and a half, and they're wondering what's wrong with my knee joint. That opens up a large workup of trying to figure out why that joint hurts. You need to look at, why did you have that knee replacement in the first place? By that I mean, did you really need to have a knee joint replacement? Then you look at the post-operative x-rays. Was the knee joint put in right? Is it the right size? Then we discuss your post-operative recovery. Did you have any signs of an infection? Or was there some sort of a problem that occurred in the immediate post-operative period that would prevent you from getting your full range of motion? Assuming those are all okay, and we really go through great steps to make sure there's no underlying infection. When we think of an infection in knee joint, we think of it being red and hot and having a fever and feeling downright lousy. That's not always the case. Sometimes you can have an infection that is very, very low level infection. That means the knee joint just hurts, but it doesn't look red, it doesn't get terribly swollen. So that's something that's very important to rule out as we're working up why that knee is painful. Some of us form a lot of scar tissue. That can be very problematic in the sense that we've done our best effort at the rehabilitation, but yet the knee joint develops a lot of scar tissue. Usually with that, we recommend giving it time and keep working at the rehabilitation and range of motion. If that still doesn't work, sometimes we have to go in either with a TV camera, or we open up the knee joint and remove some of that scar tissue and really commit to working on range of motion afterwards. If all else fails, occasionally we have to talk about a revision. Now, this is really quite infrequent, but if that is the case, you want to seek out somebody who does a lot of revisions. Usually this is going to be a fellowship trained joint replacement surgeon like myself who does a lot of this, because this is where experience does matter a lot. You want to have somebody who knows their way around the knee joint very well, who can determine what the best revision prosthesis is for you and get you back on the road to recovery once again.